This episode is brought to you by Tido. Tido provides managed integration services, EHR, data migration archiving, workflow automation, and 24/7 monitoring to ensure seamless data exchange and improved operational efficiency. Are you and your team attending Vive or HIMSS and looking for next level efficiency? Book a meeting today and qualify for 6 months of our MITRE solution. Check the show notes in the description to access this limited offer.
With our managed integration solution, not just waiting there for someone to assign it, we actually know what's upcoming based on what we have already seen, all the way from assessment and what new systems are being implemented.
Welcome to This Week Health. My name is Bill Russell. I'm a former CIO for a 16 hospital system and creator of This Week Health, where we are dedicated to transforming healthcare one connection at a time. Now, on to our interview.
Welcome to today's Solution Showcase with Vik Patel and James Wellman. James Wellman is a VP and CIO at Nathan Littauer Hospital and Nursing Home, is a comprehensive healthcare facility located in Gloversville, New York, providing a wide range of medical, surgical, and long-term care services. Vik Patel, COO of Tido, Inc. Tido is a comprehensive healthcare IT solution provider specializing in modernizing healthcare environments, securing interface infrastructures, and enabling real-time data connectivity. We're here today to tell some amazing stories about the work you two have done. Welcome to the show.
Thanks,
Thank
Sarah.
you.
Great to be here.
Absolutely. I'm going to start with the obvious. And can you both share how your initial meeting at HIMSS sparked the idea for collaboration and what made you decide to explore the Tido product suite together?
Well, I can kind of start us out there. Vic reached out to me prior to HIMSS. We connected through LinkedIn and we started talking, found we had some common things from our past, from areas where we lived in Kentucky. So we thought that was interesting. We agreed to meet at HIMSS and have some conversations because he was explaining to me his company's offerings, what they could do. I was telling him what we needed, but we met in person at HIMSS with his team and kind of started forging a relationship there. So it's about relationships. So that was a really important component for us.
Yeah, and that was exciting, meeting in person. And I say that because, I have been following James on LinkedIn for a while, and we've been talking through the messaging, and I was like, hey, let's meet finally last year. And so that was nice. And like you said, we both went to University of Kentucky. We both lived in Lexington, Kentucky for a long time. And which, by the way, this year in Vegas, March Madness should be a lot more fun. Kentucky's doing really well for all the basketball fans out there.
Well, last time I checked, y'all were ranked 8th nationally. So I guess it's okay to say go Wildcats.
We have hope with hope. So
Love it. Well, building a relationship before the partnership began is rare today. How did that foundation of trust shape the success of the collaboration?
I can say for me, it's a core component of who I am. As far as a CIO, it's a relationship game. If I just want to buy a product, I can just do a basic, like, I need this, give me that. And it's just a black and white transaction. In this case, that's not what I like to do with partners who we look at beyond that. I think vendors who just want to give you something versus vendors who want to help you. And I think that was a key component. Through the conversations with Vic, that started growing. But the face-to-face and in person, there was obviously, we connected, we linked up, and it was, how can I help? Not what can you buy from me? And I'm always looking at these vendors of like, how do they want to treat the transaction with me? I've worked at extremely large healthcare institutions where people are beating down the door to show up. And I'm at a point now where I'm at the smallest healthcare system I've ever worked at. And when you show up, that says quite a bit to me. And that was really important. But I think with all good vendors who want to be partners, it's a relationship game. So that was critical to me. And it felt obvious to me that shared the same exact kind of mindset when he started speaking to us.
No, I appreciate that. And, Sarah, I feel like similarly, in somebody in James's position, or you were CIO for a long time too, I think it's easy for you guys to see when somebody's bringing value, right? And it's not just about selling a solution or a service, because sooner or later you will realize what's going on here and if you're actually getting any value out of it. So it's not the way we work, and definitely want to make sure that is actually a problem that we are solving and working together. So I appreciate James's comments that he likes our approach.
Well, and he points out, which is so critical as a CIO, treating me the same in a positive manner whether I'm running a $200 million organization or a $2 million organization, speaks volumes about how the relationships are built. So James, what stood out to you during Vic's initial assessment that gave you the confidence to move forward with modernizing your environment?
What was interesting to me was initially when we spoke, I said, look, there's just because I'm asking you to do the assessment, there's no guarantee that we're going to ask you to be the solution provider with that. And again, it's kind of approach that I normally take. So when they came in, it was just really honest. They talked to us about what they'd found, the opportunities for improvement with the current package that we had on our interface engine. And let's just say the problems and opportunities were vast. So one of the things that they did is they put it very clearly and concisely together, showed us how we could have some quick wins, show we could have some immediate results. But they were very forthright and honest with us and said, this is going to be a bit of a long stretch on whomever you pick. You know, you're going to have to go do this for a while, make some good, meaningful changes. And, you know, we talked about that. But the key was when they were working with the team and talking to their team, there was a lot of respect. My team felt valued. They felt that they were not being talked down to at any of the time during this. And the reality of it is we did not have any experts on the interface engine at that time. The person who had done that work had left before I actually arrived at the hospital. So it was a bit of a sore point for us, and it was a lot of difficult work. So they handled that with grace, and that went a long way with us.
I love that. Vic, from your perspective, how do you approach assessments to ensure they deliver actionable insights to your clients like James?
So for us in the assessment, one of the things, we try and understand is, first of all, what is the current state, right? So starting from the current state, and then what is the future vision? What are the strategic initiatives that the leadership has planned for? And, how do we get from the current state to that future readiness? And at the end of the assessment, as James is saying in the document, we have a very clear picture of what is currently in place, where the gaps are from a technology perspective, where the gaps are from an expertise or resource thing. And then we also come up with a detailed implementation roadmap to get to the future state. And there are regular check-ins to make sure that the milestones that we have in the plan are being met, just because we know that a lot of the future initiatives like, cloud implementations are actually dependent on it. And I was just talking to Lance on James's team that, hey, once we have a milestone coming up, once we are fully live on the new engine and everything, let's do another check-in and make sure where we stand from a milestone perspective. So, it's not just about documenting what we see, but actually kind of paying attention to what the goals are and then executing it.
We talked about these kind of things, and it was obviously we shared the same mindset. So I'm all about baselining, assessing, figuring out and measuring where we go. And so that was one of the things for us that, it was obviously we had the same kind of approach to how to problem solve this. So that was a really big component on that personal meeting too.
And the assessment led to impressive advancements for you, like seamless upgrades, real-time HIE connections. You were the first in your area to do that, and proactive monitoring. Can you talk about the impact these changes have had on patient care and operational efficiencies?
Absolutely. So for us, like I said, we did not have a reliable interface. And so we spent a lot of time trying to troubleshoot these things, work with some different third parties, or not even realizing that things were not working or wasn't totally disastrous, but it made the work a lot more difficult. So when we first went into this, they identified some of the immediate problems. And so we just said, well, we like that. We did a short-term engagement, and we hired them to do some part of that things that came in, and they fixed those. And what we quickly realized was that's not a worry anymore. We're not coming in every morning. I'm not waking up in the middle of the night because things aren't processing and somebody's calling us. So we really like that approach. And the next thing you know, we said, well, let's look at extending this for a year and maybe kind of going all in. By doing that, it allowed us to focus on where we really needed to do some enhancements in our expanse build, things that we'd not been able to do before. It was noise, but it was a loud and important noise off to the side. But it took the focus away from the things that we were doing for our providers, for our clinicians, so that they can serve our patients and residents better. And like I said, those are the types of things when we want those relationships. I want somebody to help us understand the mission. We're in healthcare and we're in IT. I don't do the direct clinical touch on a patient, but we sure impact it and save lives every day. And we feel like we are part of that. We know we're a part of that. So by having them on the team, that just took one thing out of our hair that we had to worry about anymore. Not that I have much hair anymore. So those are the kind of the challenges that we have to have. And the team honestly was a little reticent. They had not had good experiences with some vendors in the past because they had not approached the relationships, in my opinion, correctly and managed the expectations. This was one of two simultaneous relationships we had going on at that time. And so the team really embraced this and they saw that, oh, this is a vendor that's here to help. This is actually a partner and not just a money exchange, which is how they viewed it previously. So that really helped us a lot. And that eased the tensions on my team. And it allowed us to move forward and worry about the day-to-day.
Thank you for that assessment. That was really good. Maybe I'll give a little bit more technical side of things, so what has followed since the assessment and what we have been able to implement. So we went from, knowing exactly all the interfaces, all the integration that's happening between the internal and the external applications is working seamlessly and it's being proactively monitored. And, this is where I think from a patient care, it's definitely a huge impact. So instead of having to call in and the end user having to call in tickets and someone trying to figure out what's going on, instead now our team can actually proactively see what's happening, take care of the issues before even somebody has a chance to call in.
It's preventative care. I mean, we're avoiding problems now that have been sadly routine and accepted. That's just what it does. It goes down and we're like, no, that's not that. So they allowed us to set a new operational standard. They should expect excellence and not accept mediocrity. And that's something we want to push.
Well, you've turned problem solving into problem avoidance together. So what are some of the examples of the challenges you've proactively addressed? How has it benefited your teams and your patients?
One great example was last night. We had a comprehensive update and upgrade from things going on across our entire server farm and Meditech. Everything was restarting, and that's always gives you a moment for pause when you're resetting everything in the data center pretty much. But there were some big patches that came out, big things we had to test. We were prepped, we were ready. We did that. Interestingly, in the background, the interface engine never really had any problems at all. It recognized it, anything that was going on. There were no calls, there were no lost data, nothing. So nothing this morning walking in. After the team was here last night, I didn't wake up to any bad phone calls or texts, and that's not always the case. So those are the kind of things that's invaluable for our team. We're a small team, and so if we have to spend a lot of time working on that, we're not doing anything else. We're not making it better. We're not helping people out. So that was a huge one just to see it happen last night. And that was the first time we've had anything of that magnitude since we've had the partnership to do this type reboot, other than some major upgrades. But we went to bed last night and didn't worry about it. And I think that's a really huge component for us.
Yeah, and we saw it happening. Our monitoring solution creates tickets whenever it sees issues or downtimes. And I did inform the team that this is upcoming and, it's okay. So when it does create it, and it actually auto closes, the AI solution actually auto closes the tickets too as things get resolved. So we did see it happening and things getting resolved as expected, which if it wouldn't have, our team would have jumped in and, made the calls or worked on the issue. But yeah, so it's definitely both ways. If we actually do see an issue and it's not resolved, we will be the one calling in somebody in IT and saying, hey, we still see this issue. It's not resolved. This is how we should fix it. But just letting you know that this is an outstanding issue and we are actually working to resolve it, which is kind of the opposite of a clinician or somebody in the ER calling in and saying, hey, I've been waiting here for 45 minutes or, however long, and things still are not good. So anyways, it's just a whole reversed case here, while IT knows what's going on before the clinicians ever realize that there was an issue.
You have a new marketing slogan, Vic. You can say, we don't keep you awake at night. Remember, that was always the question we get, what keeps you awake at night? You're like, you know what, actually part of Tido, I don't have to stay awake at night during upgrades now, which leads us to how you both emphasize the importance of Tido becoming an extension of James's team. How has this cultural alignment and hands-on engagement contributed to your success?
For us, they're literally like a part of the team. So they're on our phone calls. They work with multiple vendors that we're on, whether it be for Meditech for Expanse or GE for their Muse product, all these upgrades. We treat them as a member of the team. In fact, they've had, one-on-one meetings without anybody from our direct organization on the call. And then they just give us an update, let us know what's happening, feed into, the projects that we're doing. And I can't hire that out and put somebody here locally that can do that level of work. It's a challenge, so where we are here in upstate New York. So again, it's kind of the thing for the team to sit down, and that team has to trust now. And they represent us. And when we've been on the calls, they represent us very well. So we take pride in our name and who we are and the work that we're doing. And they're an extension of that. So we treat them like the team and they act like our team. I can't really give a higher praise.
Like, how do you cultivate a culture within Tido that actively drives client success and builds this level of trust over time?
I mean, Tito stands for this is done. So I'll start there. And, we do take it very seriously about making sure that our team stays on top of everything and we get things done on time. And James should not have to call me ever other than talk about Kentucky Wildcats, So if he's getting distracted from his focus and he has to make a call to me or message me about our team or issues, that's where we fail, right? That's where we are not delivering our promise of this is done and, being an extension of his team as he's talking about. So we strive very hard to make sure that that doesn't happen. Back to your question, I just want to add that the other thing about being an extension of the team, we really make an effort so that nobody on James's team has to tell us what to do, right? It's not about like, oh, here's the task, go and work on it. Like, that's not what it's supposed to be, because with our managed integration solution, not just waiting there for someone to assign it. We actually know what's upcoming based on what we have already seen, all the way from assessment and what new systems are being implemented. So we are part of the team, all the way from a new application selection, all the way to operations. And it's really good. Their team is amazing. They don't see us any differently. They'll talk to us as if we are sitting right there in New York, right? We're just part of a team.
So from a compliance perspective, staying real time is a game changer. And James, you've been at your organization long enough to really be on that complete modernization journey. How has Tido helped Nathan Littauer stay ahead now in areas like regulatory updates and interface security?
So I think that we've started expanding and having conversations about going well beyond the interface engine with them. And obviously, I'd be remiss if I didn't say they're more than that. So coming into this one, again, once you get that relationship and they've earned that trust, we have started to look at different ways as we upgrade and make our changes, have a lot of things to meet. New York has put some pretty hefty unfunded mandates on us around cybersecurity that we should be doing anyway, obviously, but not always easy. Again, as you're looking at these things, who are we talking to? Where's that data going? And honestly, before Tido came in, we didn't know that. And that's really scary when you're a new CIO coming into a location. I'm like, okay, where are we sending everything? And nobody knows, honestly. And, they kind of know, but there were old interfaces from years ago that were still up and functional. And, that really gave me a lot of pause really quickly. And we didn't understand the magnitude of that until the assessment began. We thought we had a good idea. So that allowed us, again, to close a lot of loops, go into and find things out that put us at risk unnecessarily. And we're almost at the end of a 9-month journey where we're getting ready to settle everything in and be 100% on a new engine. But we have cleaned up the old one too to reduce the risk. So it's not like we say, well, we know we're open over there. Those got cleaned up really quickly right after the engagement started. But again, I don't have the expertise here. I know what I know, and I'm smart enough to realize that I need to get people smarter than me to work on some of these things. So that was sometimes that's a lot easier than I want to admit. But in this case, it's just critical. We watch every day in compliance. We have to, teach our teams, make them understand what that actually means. It's just not some words and some things and boxes that we check. People trust us, and we see them at their most, sometimes at their most fragile. state. And we want to make sure that we meet every criteria to keep that data safe and to be able to keep treating them close to their families. And having a valued partner is a huge component of that. That's the only way we can survive and move forward.
And I think, Sarah, it's going back to your, Tito allows you to sleep at night. And I mean, it's so important because I have seen situations where, a point-to-point interfaces where nobody knew that this data was going to this vendor when the vendor was already out of business for at least a year. It was maybe they still had that, those data points, those interfaces open, and somebody was still sending data to someone who is out of business. So who knows where that data is going? I mean, so that's where, I think it's very important that if James ever tells us, hey, who are we sharing the data to today, internally and externally, that should be produced within 5 minutes, right? It's like, this is exactly where you're sharing your data. And hey, turn this off immediately. These people, they have an issue, right? Like that's where it should be. And that's where Nathan Littauer will be. And they at the end of this month, but that's where I think we should strive to, instead of, I think we know where our data is going, which is quite risky.
What's coming in? It's a bi-directional interface in certain cases. So things are coming in and we're like, what is that? And those are, and I've seen that at other organizations, but that's something, I want to know. Now we know exactly what's coming in. We know exactly what's going out. We've had that solved for quite a while now. And like I say, at the end of the month, it'll be 100% fully automated. So, we're looking forward to that. It's just one more step.
And there were conversations with CIOs when the change event happened this last year. And some organizations said it took us 6 to 8 hours to figure out how to turn off an API because there was no documentation and nobody actually knew much about it. And with a flip of a switch to a degree or a few strokes on a keyboard, Vic, you could shut that down in seconds.
Yeah, exactly. Not even just one.
We were shut down quickly and cleanly. So
good.
Yeah.
So what does the phrase set it and forget it mean to both of you? And how has that philosophy shaped your day-to-day operations?
So you earn that title with me, whether you're part of the team, a vendor, or somebody that's in here. So I take it seriously. I just don't have the capacity and the bandwidth to do everything for everybody, but there's so many important roles and things that we have to do on a daily basis. So that's a really huge component. And now from our interfaces and going forward, and as we continue to expand on that, that's one of the things we kind of said with them. They're a part of the team. So we give the assignment, they understand it, and then I can go on to the next thing. I get updates. I don't have to call and say, well, Vic, what's going on? I gave you this 2 weeks ago. Have you looked at it? I don't get excuses. I don't have to make that call. So that to me is the set it and forget it. I get it. I get the updates. I know what's going on. If there's a challenge or an issue, we know about it. And because they're interacting with the team daily, I really, personally, as a CIO, I other than, like I said, Vic will text me and we'll talk about, oh, that game was great last night, go Cats. But I'm not getting, hey, this isn't working. No one's doing this. And that goes both ways. Our team has to embrace that as well. And they have, like I said, so it's an earned trust to say that we can do that with somebody or a person. And so that's really a critical thing for us. And it's nice to say it, but we don't take it lightly.
Yeah.
And that was really well put. So the only thing I can add to that, for us, set it and forget it. I think for us, we want to make sure that our team knows exactly, has the pulse for interoperability at Nathan Littauer, in terms of what projects we are working on, and even from an operations standpoint. And there's a lot of automation there, right? Which I mentioned. Our AI tool is constantly watching, and it's creating tickets for our engineering team. So that's what it means for us, making sure that we are proactive, I would say. So maybe reduce your 4 words to 1, that's what it means for me.
How has the partnership influenced the way your teams collaborate internally and externally with other stakeholders?
For us, it's set a bar. So we have a couple of vendors who we say meet this criteria, and the team has earned that. So now when we're talking to somebody new about a different project, something unrelated, they compare how we work with Tito and how this new vendor comes in. And so they've already said that to me a couple of times. They're like, well, it's not Tido. They're not doing this, and they're not jumping on the calls and helping out the way we thought they would. So it set a bar. And I've always said, don't lower the bar or people will drop to meet it. And we raised the bar, and we've been trying to raise the bar high. So setting that example has been huge for our team. So now they have that expectation for every vendor that comes in. And now they also know how to express it. We select blenders as a team. Everybody's involved if you have a voice in what that vendor is doing or providing. So I need to hear them, and I need to see how that vendor interacts with my team. And that was a key component for the way Tido did. They interacted with the team. Some vendors sometimes struggle and keep trying to sell me, and I keep trying to tell them I'm not the one in the trenches doing the work. Sell the team, because if the team doesn't trust you and this doesn't work, then we're not going to be partners. So I like that. We refer to that, and they can look at that relationship, and that's how they expect everybody to be now, frankly.
That's awesome. Yeah, I mean, even in our weekly check-in call today, there were a couple of things, Sarah, where, I think both Lance and Moshkin on their team, mentioned, hey, we should get together and brainstorm about this thing. You're talking about some other alerts and, how we can stay on top of it or how we can clear those out. And we're actually working with the EHR, which even the EHR, hasn't addressed those in the past. So, something new, which we will probably address, and the EHR might use it at other clients. So that's actually really good that we are coming up with new solutions that's going to help not only this organization, but probably help other organizations out there.
Well, I was asking what's next in your partnership, because you're creating an influencer environment at the same time, which I find fascinating in that aspect of the ability to share your story, but then truly be able to help people make better decisions in their organizations. And that is a level of influence, because when you're trusted in the industry and your partnership is highlighted in the industry, then they're going to come to you organically and say, oh my gosh, James, I want to sleep at night. I want to free up time for my teams. I want to make sure that the partner is telling me before there is a problem, as an example. So what are potentially some of the new innovations, goals, or opportunities on the horizon you're particularly excited about?
We're having some interesting conversations around some archival solutions for us. I think that's something in my experience that it seems we forget, that we need to easily get to that other data or that old data. And in our case, that was not taken into account when they transitioned into Expanse. So we're looking at those opportunities and seeing what they can be. And nothing's off the table. We talk about it, and we know that we're not going to possibly hire them for every single thing that we do, but we have enough of a relationship now. We want to talk about every single thing that they're doing. And because we talk about our challenges that's going forward, they sometimes come up. Or in the other thing that I've seen, and I like this, and they're like, that's not really something where we are, but hey, we know about this group or we know somebody else here. So I like that aspect. But right now, I think, we know we need some challenges around some archival and some data, and they're doing some interesting work with Meditech. Obviously, that's important to us. So we're looking at being maybe on the tip of the spear or pretty close to it at this point.
Yeah, no. And so archiving is definitely something we have worked with many organizations, and hopefully that's something we can also execute here for the legacy systems. And I think, Sarah, we only focus on a few things at Tido, integration, data conversion, data archiving, automation. These are, we don't try and do everything, but I feel like what we do really well. And we have actually said, on certain new projects, when somebody's excited about, hey, can you guys do this? And it's like, you probably can, but, it's not our domain. And, let's focus on what we already have so much experience with. So I think the other one, I know even from a cloud preparedness, I think that's also something many organizations are considering more and more, moving the assets to the cloud. So even there, I think, James, we'll probably have some brainstorming and interesting architectural conversations, making sure how, like you were saying, the data coming in, how do we make sure that all that actually doesn't always end up directly on your on-prem servers? Because again, we know, especially nowadays, from a security standpoint, the issues are many times with your partners, not necessarily in your infrastructure. So we'll definitely come up with, from what we have done in the past, the architecture, the right architecture to have a framework in place that reduces a lot of that risk.
And we've taken that. So for the last year, when we've been talking, and they've been helping us with this transition, they knew our long-term plans. Our long-term plans in 26 is we will do a cloud migration as we get the organization ready and our platform ready to do that. You know, you just can't say, well, we're just going to jump to the cloud and flip the switch and be nice, but that doesn't happen. So there's a lot of things to do. And again, so in that regard, they've come back and they're helping us with that. And, you know, they'll be a partner for the future as we transition. And it's critical because we're going to have a multitude of applications of on-prem, remote hosted, cloud-based, and it's complex. So getting all of that even more secure and keeping it secure in these new platforms is daunting. So, you know, we're working with them in that regard as well. So that'll be a continued partnership.
And knowing what to move to the cloud or what to archive and really consider in those aspects. And some things, you'll hear me joke about, there's a couple boxes that just need to die, and you actually decide what does stay on-prem in some closet somewhere with some masking tape. That strategy, though, is so important to map out. And to your point, when you've got a partner like Tido and the ability to really understand all of the implications, and then that recovery and resiliency aspect of what happens when X occurs, it's certainly nice to have people in the boat with you and also pointed in the right direction. Vik, one of the successes in partnerships today is often about the geography of the organization, where data is housed, where the programmers and developers live. Can you share with us some of your perspectives and how you've structured Tido for those very reasons?
Yeah, it's very, very important for us. And that's why we make sure that all the Tido's team members are located only in US and Canada. And that's how we have been able to provide really good service. And our track record shows it because our executions, you know, they are on time. And the time zone difference, I think, makes a huge impact on projects many times. And we have learned in the past, having tried some of that. So yeah, today our team is only based in North America, and that has definitely helped us with our success.
Gentlemen, thank you for sharing this story and your ongoing journey with us. I know our listeners are going to love hearing about how this is working, the scalability factor of, regardless of the size of your organization, this is something you need to be thinking about and focusing upon. And when you have a partner like Tido, you can. And as your journey continues, can't wait to circle back and hear more about it in 2025.
Thank you.
Thanks for tuning in to our Solution Showcase. That's all for now.
Thanks for listening. If you found value in this, share it with a peer. It's a great chance to discuss and in some cases, start a mentoring relationship. One way you can support the show is to subscribe and leave us a rating. If you could do that, would be great. Thanks for listening. That's all for now.